In your Capital Connection tonight, Virginia Democrats are sounding the alarm, saying nearly 630,000 Virginians could soon lose their health care coverage. They say that's because some Republicans in Congress are floating the idea of limiting how much the federal government pays for Medicaid expansion. Capitol Bureau reporter Tyler Englander explains.
Currently, the federal government covers 90% of the costs associated with people covered by Medicaid expansion. The problem, however, if Congress reduces that percentage, all 630,000 Virginians covered by the expansion will immediately lose coverage. Before expansion, Medicaid in Virginia only covered mostly children, disabled adults, and working parents, making up to about 33% of the federal poverty limit. But in 2018, Virginia expanded Medicaid to include all adults, making up to 138% of the federal poverty limit, regardless of whether they were a parent or not. Per the Affordable Care Act, the federal government covers 90% of the costs associated with the newly covered population, some 630,000 people in Virginia. However, Virginia has a trigger law repealing expansion if Congress reduces the federal government's obligation below 90%.
If we lose just 1%, our trigger language here in Virginia is that 630,000 Virginians automatically lose that critical coverage.
In a statement, Republican Congressman Rob Wittman, who previously wrote a letter to House Speaker Mike Johnson saying he wouldn't support Medicaid cuts, said, quote, "I support targeted reforms to the Medicaid system that ensure Virginia's vulnerable populations continue to receive the health care coverage they need." Wittman added, quote, "No bill text has been released for how Congress will appropriate federal funds to Medicaid, but I plan to review legislative text thoroughly to ensure there's a federal-state solution to make health care affordable and accessible for Virginians." At the state capitol, I'm Tyler Englander.